Diabetes and gynae. We will talk about menstrual problem, liver, PCOS, snoring, vaginal discharge, fungal infection, repeated urinary infection, recovery from surgery for diabetic patients, and a special topic of bleeding after menopause. If you or someone in your family has diabetes, you need to be extra careful about your gynecological health. Public awareness of kidney, eye, and heart issues in diabetes is quite high, but gynecological problems receive less attention. The number of people worldwide with diabetes exceeds 53 crore. The global number of diabetes cases has nearly doubled in nearly last 25 to 30 years. But fear not. Let's explore some strategies to stay well. If you are careful, you will find solution readily available at your hand. Today, I will talk about 9 topics. The 10th topic is diabetes during pregnancy. That is not in this video. Menstrual problems of diabetes patients. Diabetic women generally are slightly overweight. Excess weight leads to disbalance in female hormone levels. Along with comes the problem of controlling menstrual bleeding. For some, bleeding may not stop or may be irregular. If the problem persists for more than 3 months, it is important to consult a doctor and get an ultrasound scan to assess the condition of the uterus. Bleeding that occurs between periods is known as intermenstrual bleeding. Seek advice for this type of bleeding earlier, as well as bleeding that affects hemoglobin level or irregular. You need to seek help. Such problems, especially after 40, may require an ultrasound and a camera to view inside the uterus. Treatment without hysterectomy is possible if any problems are detected early enough. One of the main ways to improve your quality of life is by managing your weight. But many people with diabetes struggle to lose weight. If you consult with a dietitian, fitness specialist, and a doctor, you can successfully resolve the problem entirely through diet and lifestyle modification. You just need some patience. Liver of diabetic patients. Some hormonal medications are sometimes prescribed to reduce gynecological bleeding problem. Taking this medication carries a risk of liver damage, particularly for individuals with diabetes or women over the age of 35. Excess of SGOT, SGPT, alk means liver damage. However, not all medications have that effect. Some progesterone drugs have this tendency. Progesterone is useful in reducing bleeding. Medicines to force a period delay during pujas are also problematic. If you must take the medicines, take the advice of a doctor to save the liver. Avoid such medications by all means. There are so many options in these days. If you have to take medications for an extended period of time, there are no alternatives. It is important to regularly undergo liver function tests every 4 to 6 weeks. PCOS. Daughters of diabetic parents often have a slightly increased tendency to develop conditions such as PCOS or polycystic ovarian syndrome. This is not a disease. If you follow the simple precautions of life, it is possible to control this problem before it escalates. Young women who have polycystic ovaries are more likely to develop diabetes in future. Therefore, diet and lifestyle changes should be considered from the school days. Patients with diabetes and PCOS should remember to have at least 4 periods a year. If the period does not occur naturally, then it is necessary to induce periods with medicine. Otherwise, the inside lining of the uterus will thicken. Being overweight increases the risk of uterine cancer and precancer. Check for snoring. Make sure she wakes up feeling fresh enough in the morning. Sometimes polycystic ovarian problems can cause a type of problem called obstructive sleep apnea. This is because of fat deposition on the back of the nose causes lack of oxygen during sleep. It is easy to treat if caught. And yes, don't forget to get a lipid profile done once a year. Vaginal discharge in diabetes patients. Sweets, chocolate, sugar are not only your favorite. Bacteria are drawn to the sugar in your body, enticing them to return repeatedly. There may be vaginal discharge. If the vaginal discharge is too much or keeps coming back, despite treatment, it may be necessary to change the treatment by seeing a doctor. Ultrasound scan is also needed at this time. Remember, vaginal discharge may not always be from vagina. It may also indicate a hidden problem inside the abdomen. Fungal infection in diabetes patients. Constant itching or burning sensation down below. In women, fungal infection of the vulva or vagina are very common. Vulva is not vagina. If you want to know about vulva, then you can find vulva in the link below in the description box. Fungal infections of the vulva are very common in all women, and in those who have diabetes, fungal infection often comes back. Women benefit from using a variety of antifungal medications or candida-like remedies. Unfortunately, the problem re-emerges after a few days. Occurs mostly in humid summer. In cases of recurring problems, it is important to closely examine vulva with a magnifying glass to uncover any potential underlying issues. Even if a fungal infection is assumed, this is vulvoscopy. This is not an operation, but with extra precautions, it is possible to treat the problems before it takes turn in the future. And yes, there are several precautions for vulval care. We have made a PDF file for our patients. Fill out the Google form link in the description box below to get it. Recurrent urinary infection in diabetic patients. Women's urine passage is only a few centimeters long, hence infection is more common in women. This infection is more frequent in diabetic women. If you keep on using antibiotics repeatedly, there is a possibility of becoming antibiotic resistant in the future. So, drink enough water daily. When wiping up the toilet, the direction of hand movement should be front to back, never from back to front, so that no water or tissue paper can move from back to front. Get culture sensitivity report and routine urine examination before taking antibiotics. Even if it takes 3 to 4 days for the report to arrive, you can avoid overuse of antibiotics. The best time to do a urine test in the morning. Catch the midstream urine in the laboratory pot after discarding first few seconds of urine in the pan. Taking antibiotics or Alka-Seltz before urinary culture may lead to false report. Try bringing a pot from the laboratory and give urine in the lab pot. If the culture sample is taken to a faraway lab or kept in the fridge, the culture report will be incorrect, as the bacteria may die in the street temperature and sunlight. If there are more than 3 urinary tract infections in a year, you must see a urologist along with the gynecologist. Recovery from surgery in diabetic patients. Having diabetes may slow down the recovery process from surgery. The risk is minimal in well-controlled patients. However, before any kind of gynecological operation, consult a doctor and take extra care to ensure proper diabetes control. At this time, the doctor may temporarily change the prescription for extra precaution. Bleeding after menopause in diabetic patients, very important. Take extra precaution with postmenopausal bleeding if you have diabetes. An ultrasound scan should be definitely done within 2 days of the bleeding, early. Thickening of the endometrium is common in people with diabetes. They have a higher risk of developing polyps in the uterus. Remember that with or without diabetes, any amount of bleeding after menopause requires a visit to a doctor within 2 days, so that you can check it out and return home safely. Any bleeding after menopause should never be ignored, even if it is just a spot. The ultrasound that will be done this time should be transvaginal ultrasound. Abdominal ultrasound does not capture the detailed inside view of the uterus most of the times. Gynecological cancer in diabetes patients. Individuals with diabetes and excess weight have a higher risk of developing endometrial or uterus cancer. So, control body weight as soon as you can, so that you can avoid such problems in future. Remember, prevention is always better than cure. You can easily avoid such troublesome problems by taking some simple diet and lifestyle changes. Some modern studies show that women with diabetes have a slightly increased tendency to develop ovarian cysts, tumors, and even cancers. Don't expect gynecological symptoms in ovarian problems though. If you have got gas, bloating, feeling full after eating less, loss of appetite, bowel or urinary problem, abdominal pain, definitely consult a doctor for a gynecological problem and get an ultrasound report. Uterus, ovary or gynecological cancer can be cured if caught early. Don't fear, be confident and spread these facts to safeguard your health and inform others. That's all today.